The streets are mostly empty in Mexico City as many non-essential government offices and businesses are closed. In a nationally televised address, Mexican President Felipe Calderón urged people to stay home, especially during the upcoming Cinco de Mayo holiday, to avoid being infected. Across the country, Mexicans have been stocking up on food even though grocery stores will remain open, as will hospitals and pharmacies. But some locations are running out of supplies. There are signs the prevention efforts are having an effect. Health Minister Jose Angel Cordova says the number of people who have sought treatment for flu-like symptoms has declined, suggesting the outbreak could be leveling off.
There has been a progressive decline over the course of 10 days. This makes us hopeful.
But Dr. Kiji Fukuda with the World Health Organization was not prepared to make this interpretation.
I think it's a little bit premature to try to understand more fully what these numbers mean.
Despite efforts to keep people from gathering in crowds, many Mexicans remain fearful as they wait in long lines at mobile health stands and in hospital waiting rooms. The Mexican government has been criticized for responding too slowly to the outbreak of the H1N1 virus. And some Mexicans are angry about the lack of medical care. They should have taken my husband immediately, says this woman, but they didn't do anything. Oscar Barrera was diagnosed with the flu and prescribed Tamiflu. He says since then, there's been no follow-up by health officials or tests for his pregnant wife and 3-year-old son. What worries me most, he says, is that officials don't do enough to protect my family. Some also accuse the government of being too slow to release information on where the flu victims are actually located. The health ministry maintains it doesn't have the staff to follow up on fatal cases, but the ministry says it is putting its resources behind helping people. Authorities say they've spent more than $116 million on medical supplies and equipment to help treat the flu outbreak. Chris Simpkins, VOA News.